Not this time.
I want to thank all of you for being here this afternoon for the PI briefing. Just wanted to bring you up to date as far as what's happening across the state of Alabama and in our area. As you probably already know, and most of you probably know as much as I do by listening to the national news, we have 109 cases and 11 of the H1N1 virus in 11 states and 1 death of a toddler in Texas. In Alabama, Dr. Don Williamson, our state health officer, released information in a press release at 6:30 yesterday afternoon on April the 29th, identifying 2 highly probable cases of the H1N1 virus in students attending the Heritage Elementary School in the city of Madison. The children were seen by a local physician with respiratory symptoms and were treated as outpatients. School officials have closed the school. This morning, our state public health laboratory has received 75 new samples for testing for H1N1. According to the state health officer, we are expecting to see more probable and confirmed cases of swine flu in Alabama. The swine flu, the incubation period is 2 to 7 days from the moment of exposure until symptoms develop. Individuals are contagious 1 day prior to onset of symptoms for 6 days after onset. The swine flu is sensitive to the antivirals Tamiflu and Relenza if taken 48 hours of illness. As parents and as individuals, the best way to prevent the spread of swine flu is through following your basic rules of hygiene. That is, cover your cough or sneeze with a tissue or sleeve. Wash your hands with soap and water. If that's not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, your nose, your mouth with your hands. Try to avoid contact with sick people and stay home if you're sick, and keep your children home if they are sick. Additionally, I would advise you to consider what you would do as individuals or if you're parents. What would you do if your school or your daycare center closed due to the illness? For businesses and organizations and other entities, consider what you would do to continue to provide what will be the essential services for your establishment, and what would you do if you had 30 to 40% of your staff absent at your establishment? Or if you had family members who were out due to taking care of a sick person. Now is the time to review the COOP plans, and if you're not familiar with COOP plans, that's a continuity of operation for approximately 4 years. The Alabama Department of Public Health, as well as us at the local level, have been out into the communities, in every community in Public Health Area 10, meeting with city and county leaders to encourage them to implement their pandemic influenza plan and establish a continuity of operation plans. So now is the time to take those plans and dust them off, review them, and consider the implementation of them should the situation get worse. What constitutes pandemic influenza? We have to have a novel virus. We have that already. That's the H1N1. It's easily transmitted person to person. We have that component. It has to be at least severe as a regular seasonal flu. We're not quite at that point, but it seems to be getting there. Across the United States, every year, approximately 36,000 people die from seasonal influenza. In Alabama, we have approximately 500 to 700 deaths from seasonal influenza. As of right now, we all know that we have only 1 death due to the swine flu. What are we doing at the local level as far as our local health departments and the state health departments? Of course, we have increased our surveillance. That has been occurring since Monday of this week, where our surveillance staff, our nurses, have been in contact with the medical community to answer questions and to assist them with collection kits and information that they will need to send samples to our state public health laboratory for testing for the swine flu. Today we've established a system whereby we can disseminate information from state level to city and county officials, to department heads, and to the medical community in particular, what is happening within our area and within our state. We are encouraging the hospitals to log on to AIMS, that is the Alabama Incident Management System. Our state level folks are desperately in need of this information, so they will know what's going on at the local level in order to meet your needs at the local level. So we will encourage the hospitals to log on to AIMS. Now, it's anticipated that the swine flu will be detected in our area. We already have the 2 highly probable cases in North Alabama. We expect to see it here in our community as well. What I would leave you with is that it is appropriate to be concerned, but don't panic. And we are preparing for the worst, but we're praying for the best. And also, I know that a lot of officials are torn, especially school officials and county officials are torn between overreacting and not reacting. That's the situation we all find ourselves in, since this is something new that we have not dealt with before, and that is certainly a concern. Also, to help the community at state level, they are in the process of developing a 1-800 number for the individuals to call concerning swine flu. That is, as of right now, that's the information that I can share with you concerning Alabama, the state of Alabama, and our progress as far as the swine flu development, as far as what we know. I'll be happy